What is a panic attack disease? A panic attack disorder is a disorder that involves sudden waves of fear, often overwhelming waves. The difference between a simple attack and a complete panic attack is the symptoms of time that persists and the severity of the symptoms. Usually, a panic attack will disrupt your life and completely change the way you do your daily activities, nightlife and social life. However, a panic disorder is a relatively common condition. Usually, the symptoms come without warning and make the victim feel scared, nervous and scared for no reason. These episodes can take minutes, sometimes even hours, and can be very deactivated to most people as they can freeze someone as a deer in the headlights. Being crippled by fear is a real notion to those who experience regular panic attacks. The reason. The cause of a panic attack is usually not obvious, but it is something that is generally normal as part of a stressful and regular modern life. The development of panic attacks is usually associated with a lack of adequate brain coping skills rather than brain function or biological disease, as the idea behind panic is the mismanagement of stressful situation. Mental health professionals often prescribe different types of therapy. This includes color therapy and hypnosis, but generally results in a discussion of fears or anxiety removal to understand an appropriate coping plan that mitigates the effects of stressors. However, in some more serious cases, different medications may also be prescribed to help balance the chemicals in the brain where stress and adverse reactions may be unbalanced. What are the symptoms? Panic attacks usually have a variety of symptoms, including chills, palpitations, sweating, chest pain, shortness of breath, asphyxia, or feeling caught, nausea, dizziness, cramping, tingling, numbness, chills, heat, blink, and even the out-of-body experience or emotion associated with this experience. There are other symptoms as well, but many of them depend on the person suffering from a panic attack. Again, the difference between a panic attack and a panic attack is the frequency and overall severity of anxiety and symptoms. Many people with seizures seek advice and are also prescribed medication to combat the effects of symptoms. As anyone with a panic disorder will tell you, anxiety can be made worse, and without professional medical help it can cause serious problems.
Treatments for anxiety attack. There are several steps that you must follow when considering an anxiety attack treatment. First, identify the symptoms with your healthcare provider and plan your attack. Keep in mind that only a trained medical professional can correctly diagnose an anxiety attack, and therefore can prescribe a practical treatment for an anxiety attack. In general, miracles do not happen, and bouts of symptoms of an anxiety attack make up only half of the total problem. Your doctors will most likely rule out any related illnesses first. Some medications or illnesses can cause many symptoms of an anxiety attack, and therefore must be identified and treated first to resolve any other possible problems. In fact, a change in treatment or a diagnosis of another disorder can cure panic attacks and anxiety. It is important to document your symptoms before visiting a doctor, because you are ready to accurately analyze them. There are many conditions that can cause anxiety attacks or an anxiety disorder. These include, but are not limited to, low blood sugar, certain heart diseases, excessive caffeine use, drug use, tumors. Some tumors cause an excess of adrenaline, which can lead to obesity, an attack of anxiety, or an overactive thyroid. These and other conditions can cause anxiety attacks and may be the main cause of your problem. An effective treatment plan for an anxiety attack can help solve these specific problems. The key to life. It is also important to evaluate your lifestyle. If your level of anxiety violates your ability to live a normal life, it may be time to go to a professional. There are some signs or red flags to consider when deciding whether you are a candidate for a mental health professional position, including a feeling of lack of work or a feeling of uncontrolled eating habits. Habits or appearance or hygiene patterns, breaking social bonds, sleep problems, eating problems and bathing problems. There are, of course, many other possibilities in these ideologies, but concern is one of the possibilities to consider. It is important to remember that stress and anxiety are part of the normal lives of many people. However, coping with this stress is the difference between a person suffering from anxiety attacks and a person who can manage well. Find treatment plans for an anxiety attack if you meet. A mental health professional can provide you with tools to deal with your daily routine and working situations, overcome stress and anxiety, and return to a basic, healthy lifestyle.